Have you been doing everything right for your diabetes, cutting carbs, taking your meds, tracking your blood sugar, but still feel like something's missing? What if I told you that the real problem isn't your glucose meter or your diet, but something much smaller, minerals that you may never have thought twice about? These tiny nutrients can make or break your blood sugar control, and most diabetics are low on them without even knowing. In this video, we're diving into the top 3 minerals that every diabetic needs, how they protect your body, how to get more of them through food, and what to avoid if you don't want to stay stuck in a blood sugar roller coaster. What you'll learn if you've been feeling drained, dealing with nerve pain, or struggling to stabilize your glucose levels, this could be the piece you're missing. We'll break it all down in simple terms, no jargon. So grab a cup of tea, sit back, and let's fix this from the inside out. And if you care about your long-term health, hit that subscribe button because we've got more life-changing diabetes tips coming your way. Mineral number 1, magnesium, the unsung hero, magnesium. You've probably heard the name, but what does it actually do? Turns out magnesium is like the body's electrician. It powers muscles, nerves, energy, and most importantly, insulin. Here's the kicker. Every time your blood sugar spikes, your kidneys flush out magnesium. So high blood sugar suck magnesium loss, and that starts a dangerous cycle. Let me paint a picture. When you don't have enough magnesium, your muscles cramp up, especially in your legs and feet. You feel tired even after a full night's sleep. You get heart palpitations or feel anxious for no reason. And your blood sugar, it stays high because your cells stop responding to insulin. It's like trying to drive with the brakes on. Magnesium also protects your brain and nervous system. It reduces nerve pain, helps you sleep, and even supports hormone balance, affecting everything from mood to libido. Now here's where it gets practical. Top magnesium-rich foods. Pumpkin seeds. 1 ounce gives 40% of your daily needs. Spinach cooked, 1 cup gives 38%. Almonds, 1 ounce gives 27%. Avocados, 1 medium adds 15%. Dark chocolate. Yes, really. 1 Oz, 24%. Gourmet. Bonus. Miso glazed salmon with sesame spinach, almond crusted halibut with salted Swiss chard, dark chocolate mousse with black truffle. Yes, it's magnesium rich. Best supplements. If you want to go the supplement route, magnesium glycinate gentle on the stomach, Thorn magnesium bisglycinate, 200 mg per capsule, doctor's best high absorption magnesium, great bioavailability. Avoid magnesium oxide, it's poorly absorbed and often causes stomach upset. What to avoid? Processed carbs, white bread, pasta, too much sugar, energy drinks and soda alcohol, and calcium-heavy supplements, mineral literature too. Zinc doesn't get much attention, but it should, because without enough zinc, your pancreas struggles to release insulin. Your immune system weakens, and your body starts breaking down faster. Every time you urinate, and diabetics urinate more often, you lose zinc. So even if you eat healthy, your body might still be leaking this essential mineral. Signs. You might be low. Cuts and wounds take forever to heal. Constant sugar cravings. Catching colds often. Dry skin or rashes. Loss of taste and smell. Hair thinning or white spots on your nails. In both men and women, zinc affects fertility and libido. Low zinc, low testosterone and hormone imbalances. It also makes diabetic nerve pain worse and increases the risk of kidney disease and vision loss. At a cellular level, zinc is like insulin's best friend. It helps it bind to cells and do its job. Top zinc-rich foods, oysters. Just 3 medium ones, Norgar 200% of daily zinc, beef liver, 100 g beef, 80% pumpkin seeds, 1 Oz, or 50% grass-fed beef, 100 g or 40% chickpeas cooked, 1 cup, 25% gourmet bonus, oyster sashimi with ponzu sauce, French beef tartare with a quail egg, grilled lamb chops with a toasted pumpkin seed crust. Best supplements, zinc picolinate, easy to absorb, Thorn zinc, picolinate, 30 mg. Now, zinc glycinate, another great option. Pro tip, if you're supplementing long-term, pair with copper. Since zinc and copper compete for absorption, what to avoid? High sugar diets, too much calcium alcohol, phytates in whole grains, soak or sprout to reduce them. Mineral number 3, chromium. The insulin amplifier. Chromium might be the most underrated mineral for diabetes. It's essential for your insulin to work properly. Without it, glucose can't enter your cells, no matter how much insulin you have. Chromium is part of something called the glucose tolerance factor. It literally helps insulin unlock your cells. But here's the catch: high blood sugar makes you pee out chromium, and your body doesn't store much of it. Signs: you might be low blood sugar, harder to control, constant sugar or carb cravings, brain fog or low energy, mood swings or anxiety, tingling in hands and feet, low libido or irregular cycles. Chromium also protects your kidneys, your nerves, and even your heart. It lowers bad cholesterol and supports fat metabolism. Top chromium-rich foods: broccoli 1-2 cup, 50% grape juice 1 cup, up 40%. Limit this if diabetic. Brazil nuts 1 nut, up 30%. Lean beef 3 oz, up 25%. Eggs 1 egg, up 10-15%. Gourmet bonus: Wagyu steak with broccoli and Brazil nut pesto, lamb chops with rosemary grape reduction, duck liver pate with poached egg and roasted mushrooms. Best supplements: chromium picolinate 200 mg day is a good start. Thorn chromium picolinate 500 mg for more severe cases. Look for picolinate or polynicotinate forms, not chloride. What to avoid: high sugar, refined carbs, too much dairy, calcium blocks absorption, white bread, soda, pastries, alcohol. Again, wrap up and call to action. There you have it, the 3 most important minerals every diabetic needs: magnesium, zinc, and chromium. They help your insulin work better, protect your nerves, support your heart, and give you more energy to live the life you want. So, take a moment and ask yourself, are you missing any of these? If this video helped you, like it, drop a comment with which mineral you think you need more of, and subscribe for more science-backed tips to master your health naturally. Stay safe, stay balanced, and I'll see you in the next one.